Thank you all so much for sticking around. Well, if you didn't know, May is Mental Health Awareness Month, and as we close out the month of May, we want to remind you of the importance of mental health and the services that are offered. So I am joined by Ms. Karen Kramer of Greenleaf Behavioral Health Hospital to share those details. So thank you so much for joining me. How are you?
I'm doing well. Thank you for having me.
Awesome. So I'm here to talk about, we're here to talk about mental health. So what services does Greenleaf offer?
So Greenleaf Behavioral Health Hospital has different types of services. So we have inpatient services for individuals that might need crisis stabilization.
Gotcha.
So we have 113 beds designated for adults and children. We just opened up a new unit for pediatrics for ages 5 to 11. We're also looking at expanding and opening up a GERI unit in the end of October, beginning of November. So that would include ages 55 and up with a specialty focus in geriatrics. We also have outpatient services. So we have intensive outpatient services for adults and then also teens.
Gotcha. All right. And so what mental challenges would you say are you seeing a common trend in?
So definitely, I think with focusing on Mental Health Awareness Month too, I think really focusing on where folks are at and as far as mental health diagnoses and issues that they're dealing with. So definitely folks dealing with suicide ideation, depression, anxiety, substance use disorder. So we can work and treat with all of those different diagnoses.
Okay. Now, would you say that it is seasonal when it comes to?
Yes, I think there's a pattern that you can see sometimes with mental health and substance issues. Right now with kids being out of school, so there's, they're with their family and loved ones. So I think right now there might be a little more stability in their life. And then the holidays are another time where they might be with their family, but then they also might use substances that they may not have prior to being with the family in that holiday environment. So a lot of times they might end up needing services post-holiday time.
Okay. So do you guys accept walk-ins?
We do, okay. Yes. So we are open 24/7. We can provide a free assessment at any time. So if someone wants to come in at any time during those hours, they can get a free assessment.
Gotcha. And this is another question that I wanted to ask. Is mental health covered by insurance?
Yes,
okay.
It is. So a lot of the insurance plans have either a carve out for mental health services or part of their coverage of care. So we always suggest, making sure that what their insurance will cover. So depending on their plan might determine what types of level of services that might be covered, but most often, most all insurance plans will cover some type of level of care.
Gotcha. All right, now for the month of May, it is Mental Health Awareness Month. Is there anything special or in particular that Greenleaf has done to kind of bring awareness?
Sure. So we made sure we posted out by our hospital that we support Mental Health Awareness Month. We've been making sure that we're connecting with the community, which we normally do, but this month really focusing on that mental health and breaking the stigma. The stigma is really challenging with mental health, so trying to educate and getting out in the community.
Awesome.
Yeah.
All right, and so where can we go to learn more information about the services that you offer or get in contact with you guys?
So we do have a website they can look up for Greenleaf Hospital. So we have a website, and then I think you have the phone numbers on the prompters, so they can reach out to call and get some information, find out more about our services, or ask about a free assessment.
Perfect. Well, thank you so much.
Sure. Thank you. I appreciate it.
Of course. All right, we're going to take a quick break, but coming up in